Hey guys, this is Andre Shirdan with the Eaglesoft Field Guide, and I'm here with Elizabeth. Hi, Elizabeth. How are you?
I'm great. Good morning.
Good. And you must be on the same time zone that I'm on. Are you on the East Coast?
I am.
Good. I
Yeah,
could
we're
tell by
in
the
Virginia.
in Virginia. Oh, so you're only a couple hours away from me. I'm in Pennsylvania. So
Okay.
cool. So introduce yourself, because everybody I think everybody who's going to be watching this probably knows who I am. So why don't you tell me who you are and the practice you work in, what you do in the practice?
Okay. My name is Elizabeth Ragland, and I work for Dr. Douglas Wright in Stanton, Virginia. We're excited to open up a new practice for Dr. Wright. He is currently practicing in a neighboring city, and so this is all brand new, a new market for him. So we're pretty excited.
This is awesome.
I've,
So this is perfect timing to set up new patients, new employers, new insurance companies for you.
yeah, it's great. I'm hoping I learned something today.
Cool. So one of the first things I do is when I talk about setting up a new patient is, typically it's the first phone call. Phone rings, somebody says, "Hi, we're new to the practice. We want to become patients in your practice." And what I always suggest to offices is don't start from the schedule. Although you may want to look for appointments on the schedule, you're okay to start the schedule and look for an appointment for them. But what I typically tell offices to do is to jump back to the front desk and then go to your person list. What's
Right.
important about the person list is everybody in Eaglesoft is a person before you designate them as a patient, a policyholder, or a responsible party. All right. So I was thinking about a good example to use to create a new person in this system, and I was and then I was watching TV, and the Roseanne show came on. So I was thinking, let's use that family as a way to start building a family out. How's that sound?
Okay.
All right. So the dad is Dan, and I always start with, and I'll be a sexist for a minute. I'm just going to put dad in as the responsible party and let him get the bill. It doesn't really matter, but that's the way I'm going to do it. So he goes by Dan Connors. All right. We don't know a middle name, but usually when somebody tells me their name is Dan, I always want to find out, are they Daniel? And then if they are, I want to make sure I'm putting a proper name in here. Right? Then under preferred name, I can put in the nickname. Is that what you guys typically do?
Yes, because insurance doesn't like nicknames.
Exactly. Or in my case, my first name is Tony. My middle name's Andre. And they don't like Andre at all. So my insurance company, if you send in a claim for Andre, they will just deny it and move on and go on to the next person. So, but one thing I do like is if that person has a name, or if they, we know them by, something other than Dan, yes, we could put in a preferred name. If we don't, and we have a patient like, say, George Foreman, who all of his kids are George Foreman, one of the things we could do is we can use this chart ID field to identify the patient above and beyond a nickname. So imagine we've got 3 Dan Connors. We could say this is dad or granddad, and we could put that in that area.
Okay.
So it's a great way to put something, and I call this is how do I ID my patient. And sometimes I'll just put things like Harley guy. All right.
Oh, I
Whatever
love
you
that.
can figure
I think
out,
I've used that field.
that's perfect. Redhead guy, tall guy, whatever you want. Obviously don't be derogatory about it. But this is also a great place if you didn't know how to pronounce his name. Say he pronounces his name Danielle. It could be Dan E L. So you could
Okay.
you could even put phonetic spellings in the name for people who have really difficult names to pronounce. So great way to do that. I always skip salutations, but I'm going to put a middle initial in there just for the sake of it. And is the person a patient? Are they the policyholder or their responsible party? And let's use this as a typical dude. And let's say he's not going to be a patient, but he wants to get the bill. And we're
Okay.
going to put his address in here. 105 trailer number 2, lot 5, because if you're in a rural area, you might have to use multiple things there. And then city and state. A good thing for you guys is your city and state will automatically fill in based on the practices information. So your default will be your city and state, and then you only have to change it as you go through and start building new people.
Right.
555 1 2 3 4. Home number goes there, work number goes here, and extension goes there. A lot of people don't have home numbers now. So what I suggest is that they put the home number and work number in home number and cell number in the same place. And not too many people have pagers anymore. I don't see many people unless it's your local drug dealer. I don't know anybody with a pager. But if somebody gives you, or you get caller ID and there's an extra number, I stick it in the pager number until I find out, is that a new work number, home number, cell number? I stick it in there until I find out what the use is. That makes sense?
I've used the pager number in the past for someone who has a power of attorney perhaps, or a caregiver, or someone, you wouldn't maybe directly contact the patient. So because no one has a pager, it automatically alerts you to there may be someone else.
I like that idea.
Patient.
I love that idea. That's great. Perfect. So that's going to be my new place to utilize. Since, again, because not too many people have pagers. And notice how this automatically defaulted to female. Again, guys don't typically go to the dentist, so Eaglesoft automatically defaults to female. So we only have to make that switch when we need to. Did you know that the new ADA form for 2020, the ADA form actually has another section?
Okay.
Eaglesoft is not set up to do that yet. Hopefully we'll see that in the next release of Eaglesoft, but there is no place to designate that in Eaglesoft, but there is a place on the ADA form. So
I wonder if there'll be any backlash from filing electronically.
Well, the services should be set up to do that because they've got to conform to the new ADA form. So
right.
I would think that they're ready for it, but I just don't think Eaglesoft's ready for it yet. I haven't heard anything yet. So, and then marital status, I always leave as unknown. And the only time I ever change this is if they are divorced, separated, or widowed. That way I don't make a mistake saying something to somebody like, oh, your husband should come or whatever. So that's the only time I change it. Otherwise, I leave it as unknown because, somebody might tell you they're married and they're really not.
Right.
So from a legal standpoint. So, and then, of course, birthdays, 03/06/1959. All right. And socials. Grab them if you got them and just put something in there. And then we talked about chart ID. Driver's licenses, I typically don't do, but I usually will scan a driver's license into the system if I need. All right. And then email addresses. Critical, right?
Right.
And c@gmail. And we're going to come back to setting this guy's insurance up because he is not the policyholder, so we don't have to worry about that. But he's pretty much done.
Okay.
I can just hit OK. And now he's in my system. All right. Then the next step is I'm going to try to get our policyholder in here. Now let's make that Roseanne Connors. Let's give her a middle initial. She doesn't have a nickname. Now, she's a patient. She's going to be our policyholder. All right. And she's not going to be a responsible party. All right. Because Dan's going to be the responsible party. He's going to get the bill. And the great thing is I can just hit responsible party and hit last responsible party I worked on. There's Dan.
Okay.
Use it and it fills in. All right. Now, this is one of those interesting things where, and actually, I guess we'll worry about it when we get to a kid. If this patient didn't live in the same household, or imagine it's a kid and they're away at college and we want to change this address to a college address, we could do this without affecting where the bill's going to go because the bill's still going to go to Dan. So
okay.
On the fly, you can always change this. But again, home number, work number, cell number, we're going to leave that alone. Marital status we'll leave alone. And now all we do is update a birthday. Oops. All right. And then a social for this patient if we have it. Driver's license, email address. All right. Now, it's automatically going to ask me for my employer. You ready to do an employer now?
Sure.
All right. What's like the most common employer that you see in your area?
We have across the street. We're right across the street from the post office.
Oh, okay. So let's use that one. So let's go to our employer list. And what I always tell people is you should be as consistent as possible with the way that you're putting an employer in. So I went right to US Again, I wouldn't put in postal service or mail handlers. I'm going to put in U.S. Postal Service. And I realize when I look at my list, I don't have the Postal Service here. So second option is if you have a group number, you can click on group number and search by that group number. So imagine they were 6754. Well, I don't have a 6754 in there, and I don't see anything that might have been the Postal Service there. So that's a quick and easy way to look for it, to make sure they're not already in there before you start typing something in. So let's do new, since we know it's not there. And let's do U.S. Postal Service. All right. And let's make up a group number because I don't know what group number would be. And let's say they have a $25 deductible and a $1,000 maximum.
Okay.
Now, one of the things I love doing is in the name, I want to put a couple of things here. So first of all, I'm going to put October of 19 because this is when I last updated this employer. Did you ever do anything like that to try to give an indicator of when the last time somebody updated it for?
That's a great idea.
I always do that because imagine tomorrow you're at the desk and you're setting somebody up and they call and they say, hi, I work for the U.S. Postal Service. As you look at this and you look at their group number, you're going to see that somebody in the office, me, set this up within the last 30 days. So you should have confidence based on your employees if this information is going to be correct or not.
Right.
So if you saw in October of 17, you'd go, well, that was updated 2 years ago. I think we need to fix that.
I think that would especially be helpful in a practice that has been around for a while and has, hundreds upon hundreds of employees and insurance companies, and you don't know which one is updated. So that would be perfect.
Yep. Then I always kind of put some other indications, like if they require a patient ID number, I'll put PID here. So I know that this is one that even if I got the socials, which I've already gotten, this is one that I need a patient ID number and not a social.
Okay.
So I put that in there. I'll put things like no assignment of benefits available. Imagine if we weren't in this network and the checks went to the patient. So whatever I need to do in order to give me some idea what's going on with this plan, I'm going to put it right in the name of the plan so I don't have to go digging around later on. Then I'm going to click on my insurance company list, and I'm just going to grab Delta Dental Pennsylvania. And notice you said something a couple seconds ago that kind of struck a chord with me. Notice I have got Delta Dental of Pennsylvania, Delta Dental of Pennsylvania, and then I have a Delta Dental of Pennsylvania with a plus sign after it. You can see these are all the same, but this one I know with the plus sign is positive in my world. It's the good one. You can see all of these Delta Dental of Pennsylvanias because this is what happens, like you said, when you have lots and lots and lots of employers and stuff. This is what I see in almost every office. Pennsylvania, Penna, Pennsylvania, so these are all screwy. This one's got P period, O period box. So depending on who put this in here, this is what we typically see. So I always put a plus sign after one that I know is the good one before I do a whole cleanup process. But this one I know is good, so I'm going to use that one. And no, the plus sign's not going to affect anything with submitting the claim because just like you saw on the list, somebody put Pennsylvania in here, and I've seen Pennsylvania spelled so many ways that this misspelling something is not going to cause it to not to go through electronically.
Right.
So that's my setup. There's all the information. And of course, if this is the first time I'm setting this up, I'm going to call in to get some benefit information or use real-time eligibility to get benefit information. And then I'm going to do my breakdown. I put my deductible, I put my max, and then I'm going to put the categories of coverage down here. And this might not look like everybody's, but I have breakdowns for every conceivable thing in the office because when we call to get benefit information, we typically ask, do they cover occlusal guards? Do they cover sleep guards? Is perio maintenance part of perio? Is it a separate category? So I actually have those separated. So I could say this one covers 100% of perio maintenance where they cover basic perio at 80 and surgical perio at 80. So I can split this out so that I can have every single category of coverage, even here, preventive services at 100%, but preventive non-covered services. This, in my world, would be adult fluoride. So it's a preventive service, but it's not covered. All right. Sealants, what are they covered at? All right. And then with my prosthodontics, these are bridges. These are single crowns, and these are single posterior crowns. And a lot of times, posterior crowns might have the same kind of downgrade like you would for posterior resin.
All right.
So I split these out so that we can have a whole lot more categories, so that as I'm on the phone with the insurance company, I can put these categories in and how does deductible apply, just so they work a little bit better. The last part is I'm going to go over to my notes section, and I'm going to actually put in the notes that I got from my phone call, like 2 pro fees per year, or 2 per 6, 1 every 6 months or something like that. Downgrade, composites. All right. So whatever you guys typically get, this is kind of where I want to put those notes, so that they're shared amongst all the people who come in with this group. That makes sense?
Yes. So anytime anyone does any updating of this particular employer insurance company, they go in and update the date.
Exactly. Yep. Yeah. I mean, I imagine you call, let's just call this January of next year. More than likely the plan may have changed at that point. Then you'd go ahead and change this to January of 20.
Okay.
Yeah. And that's critical because, if you're going to do the due diligence of actually going in and updating this information, that's critical to be able to see that this plan's just been updated.
Yeah, if you're going to make the effort to call and do a little updating, you might as well do the whole thing and consider it done.
There you go. Now, the last thing that's over here is the preferences. Because I wrote in here that there is no assignment of benefits, I want to make sure that it says over here that the patient is responsible for all. All right. And unchecking that says the payment's not going to be authorized to come to the office. It's going to go to the patient.
Okay.
Now, this is one that, each office has got to decide on their own. This checkbox right here says don't track the claim. This is one of my favorite things. If I do this, what will happen is the patient's going to be responsible for the entire balance. They pay it. A claim will be generated, but there won't be a claim sitting in the outstanding claims report.
Okay. So
yeah,
when your numbers are reviewed at the end of the month, it's not going to be like as if you're waiting for that money.
Exactly. And now some people don't like that idea because then they have no record that the claim is outstanding, but they're still never going to see it because the check's going to go to the patient and there's not going to be anything that comes to the office to ever close that claim. So I follow my offices that are fee for service and don't track claims. This is the way I like to do it. So it's a personal choice. So that is our employer setup. And now we've got our U.S. Postal Service in that list. I'm going to use that. And now it's connected to Roseanne. Now let's add one more kid. And forget the kid's name of that show. It's terrible. Do you remember any of the kids' name? Becky. Okay, Becky. All right. And all I have to do is say she's a patient. She's not the policyholder. She's not responsible. Click on responsible party. Bring up my last responsible party, Dan. All right. Click on has primary insurance. Click on policyholder and say the last policyholder that I worked on is Roseanne. Boom. Now, again, this says other, but again, with the new Healthcare Reform Act, it doesn't matter how they're related. It doesn't matter if they're the child, spouse, whatever. It really won't make a difference. But it's now in my system, and I can quickly see in my little window there that this was updated recently. I need a patient ID number, and there's no assignment of benefits, so we should be good here. The other nice thing is if I use that eligibility button, have you ever seen this before?
Yes.
Okay, so if I use the eligibility button and it comes back that they just went to the endodontist and they took $750 out of the benefits, well then I can automatically change this to $250 and show that the deductible has been met before I start adding more services for this patient.
Okay.
Yep. So that's
Can I ask you a question?
Go for it. Yeah, please do.
I have struggled in the past with when people use their benefits card for payment. Mm-hmm. And so I struggle with people making a husband or a wife a responsible party for that, because then they run it and they may be paying, might show their balance and someone was checking them out, and let's just say for easy math, they owed $100, but 50 of that was wife, 50 of that was husband. Mm-hmm. They make one payment and then the health savings account that they paid for with a credit card kind of throws a fit and has a kickback and wonders what the $100 was,
Yep.
instead of doing the individual. So would it be easiest to just flag the account? I'm not so sure that everyone sees that in the practice if they're being helpful and taking a payment, or is it better to each one their own responsible party?
Either way, but remember, in a walkout or in a payment, so imagine, let's open up the Connors, and let's just say, we'll use that example where they had a $100 balance, and we go to do an account payment. All right. As long as we're distributing that money, because we can do it by patient. So again, if it's a flex spending card, Visa, MasterCard, $100. All right. I could, that's right. They don't have a balance. So let's give them balance first. Good thing this isn't a real office, so I can play with it and take stuff off. Save that. Oops, I did it wrong. I gave them a credit instead of a balance. Delete transaction.
I think in a large practice, it's a little easier. The, front desk team member, that's where they sit. They're at the front desk. They kind of know. But in a small practice, when everyone's kind of wearing many hats and just being helpful, and, the person at the front desk might be in sterilization sometimes, and the dental assistant's checking them out.
Yeah.
It becomes a little more difficult.
It is, and that's the curse of having everybody not knowing how to process payments, et cetera, et cetera. But you could certainly force any payment you want, but the patient would have to acknowledge that. Now, if it came as a payment in the mail, that's a whole lot more difficult, because again, you're not going to know how they want that money to be divvied up. If that's an issue, yes, you could split the accounts. I've yet to run into that. If somebody comes in and says, no, I pay my bill, she pays her bill, then I'm always splitting their accounts.
Okay. Yeah, I was just wondering if that was incorrect to do.
No, nothing wrong with it. It's up to you. But, the bigger issue is long-term, when you go to schedule a family member, to be able to see that all the family members are due for checkups.
Right.
That kind of stuff. When you do confirmation calls, if they're in different accounts, it's, if you're using an electronic service, it's going to call once, not see that there's anybody else in the account who has an appointment, hang up, and then call back again for the other person, and then hang up. So there's conveniences on both sides. It all really depends. But just like you said, the minute somebody says to me, oh, no, I really need to have this separated, I separate the accounts.
Okay.
Yeah. And it's a lot easier to, even if you have 20-year-olds who are still, mom and dad are paying the bill. It's sometimes easier to split the accounts on that side. Even if you make mom or dad responsible for the account, it's still easier that way.
Okay.
So let's look at our employers again, and let's go back to our postal service. All right. And because of the notes that we put into the system here, I want to make sure that everybody knows how those notes show up. All right. So I'm going to go into a patient's chart, and we're going to just pull up the last person we worked on, because typically those notes are the things that the clinical folks are always trying to find out. They're in the chart, they're starting to take some x-rays or whatever, and they want to know, is the patient eligible to have FMX, or if they're eligible to have a prophy, even though it's only been 5 months. So if we hit that insurance button, the notes that we put in the system are right there.
Okay.
So it's critical that the front office, as they're putting that information in, are putting in what the back office is typically going to be looking for. So 2 prophies per year, downgrade composites, whatever they're typically asking about, that's what should go there, along with them being able to look at the breakdown and see, okay, yes, they have coverage for fillings, and that's where it should be. So those things should be right there and available to the clinical department.
That's great.
Yep. And that way, like I said, the communications that typically happen in an office where somebody in the back has to walk up to the front to ask, if the patient can have fluoride or not. If that information is right there on the insurance button, they should be able to see it right there.
And that person at the front is typically on the phone, so that saves a lot.
Yep. So let's see if I got this, and let's go back to our person list. And remember, we put 3 people in. We put Dan, Roseanne, and Becky. So now imagine we go here and Dan calls and says, hey, I'd love to schedule an appointment. The rest of my family comes. And we go to double click, and we go here and we put in Connors, and we put Dan. There's no Dan Connors in our system. And that happens because Dan is not a patient. Only Becky and Roseanne are.
Right.
So what typically happens is people go, I thought he was a patient of ours, and create a new patient, Dan, and now we have duplicate patients.
Which is a nightmare.
It is. So what I always tell people to do is, if somebody calls and they're scheduling for the first time, I said it before, either go to the front desk, or if you want to, you can actually open up the ledger or the account screen and put in, all right, he'll be in that list. And now we can go to schedule an appointment. There is a shortcut up here to schedule that patient.
Okay.
So if you need to, you can go right here and schedule them. Or the easiest way is go to the ledger, bring him up, and edit him and make him a patient. Right there.
Okay.
Yep. It's a little bit of a...
If you pulled him up from the person list to begin with, if Dan calls and you pull him up as a person and he then states he wants to schedule an appointment.
Yep.
That would just be the easiest.
That would be. Yeah, it would be great if we had a shortcut on the schedule. So instead of a person, instead of a patient, we had a person list here, but we don't. So
right.
You're going to wind up making that mistake every now and then. So that makes sense to do patient, employer, insurance company. And like I said, those lists of insurance companies, just like you see this is my example of what I see all the time as multiples. This is the easiest way you're going to be able to find out how to clean up the list, is by taking one good one, making sure all the information's in there, put a plus sign next to it. And then this is what I do for all my duplicates. I actually write the word copy and I push it out as far as I can to the margin, so that under my list and employers, I can go right down this column and see that one's in the wrong employer.
Okay.
All right.
Gosh, that plus sign saved my life.
Exactly. That should be in there all the time. I can quickly see if, who's been updated, who hasn't been updated, by seeing that plus sign on there.
Yeah.
And I can quickly go to this edit. I have 2 Medicaids in here and find the right Medicaid. Well, I don't, but I could have found the right Medicaid with a plus sign, change it to that, and go on.
Okay.
Cool. What do you guys struggle with? Duplicate patients, or have you seen that, or duplicate insurance companies and employers?
I've been in dentistry for 16 years, and so over the course of my career, yes, I've seen that is a huge problem, because they go in to immediately schedule a patient, and then 10 years ago, so and so's dad was a policy holder, but now they're no longer a policy holder. The kid is 28, but he calls in to schedule.
Yep.
And he's in there somewhere.
Yeah, and it takes a couple extra steps, but if anybody ever says anything like, oh yeah, my family comes there, I immediately go to the person button, because if you look at Eaglesoft, if you go in the clinical screen or from the schedule, it always says patient, but at the front office, it's always person.
Right.
So always start from the person button.
And I think taking a few extra steps in the beginning to set them up correctly, or to search for them correctly, saves a lot of extra steps on the back end trying to fix something when it's, jumbled up with other patients or entered twice.
I agree. Actually, I just realized, if I customize the clinical screen, I can add the person icon. I can add the person icon to this screen and get rid of the patient icon. But I can't do that on the schedule. So there's one thing that could help.
Yeah.
It's not bad. Well, cool. So what else can you think of, or you think we beat this horse?
I'm trying to think of other things that I've, run into. I think duplicate insurance companies and the plus sign was huge for me.
Yeah.
In this practice, it's not an issue because we're brand new and, hopefully it'll be set up correctly from the beginning, but that doesn't mean there's not, mistakes made from time to time.
Yep. And the good thing is, this is duplicate insurances, duplicate employers. I tell offices all the time, it is not earth shattering. Yeah, it's annoying, but guess what? If the claims are going through and you're getting paid, don't worry about it. It's something you can do as you go by. And that's why I like leaving my list leaving my list alone until I have to fix it. Because imagine I have Medicaid here. Imagine I don't have anybody comes in who has Medicaid. What's the point in fixing these if they're never going to be in? So just leave them alone until you have to worry about it. And then maybe you have somebody who comes in for Medicaid and now you can edit it and fix it as you go. But don't worry about trying to clean up this list as long as your claims are getting to the proper place.
Okay.
Yep.
I think
good. As front desk people, we always want to get things as clean and neat as possible. So I understand it.
Well, thank you for talking to me today. I learned a lot.